Are going straight to the experts in Boston to get the latest information about coronavirus. And tonight, we're joined by Dr. Sharon Wright, Senior Medical Director of Infection Control at Beth Israel Deaconess Medical Center. Nice to see you, Dr. Wright. Thank you. Governor Baker says that we are in the worst of the surge right now and that hospitals appear to be handling it well. So will your hospital's priorities change in the next few weeks, months? What do you think?
Well, we're trying to focus on what's right here in front of us, as well as start to look a little bit towards the future. And I agree, I think we are moving towards a surge right now. And I think the concerning thing is that patients who come to the hospital over the next week or so, they will get critically ill, some of them within the week following. So we're trying to make sure we're prepared for that while we're also looking towards the future, starting to think about things like when can we start opening up for procedures that maybe are a little less urgent, but were put off because of what was going on with coronavirus, and how do we get people to feel safe coming back to the hospital?
And when we talk about that reopening, as so many people are thinking about it, is there concern about a second surge? You know, if everybody's back out, possibly later this fall, could that be worse than what we're seeing now?
Well, I think we'll have some people who will have developed immunity from getting infected either symptomatically or asymptomatically, but it will really depend. I think people have been really good about staying at home, having social distancing, and the concern is that as people start to feel more comfortable, will that go away to an extent at which more people get sick and more at the same time?
So you mentioned this just a moment ago. We know that elective surgeries has pretty much been canceled, at this point. But what about traffic not related to COVID-19? Are those numbers down? Possibly maybe people thinking, I don't want to go to the emergency room because of coronavirus, COVID-19.
I think that's definitely true, and it's what healthcare has been messaging, is to try to stay away from the emergency rooms, call your doctor first, see what can be managed as an outpatient or through telehealth. So we have been sending that message, and for the most part, it's been working. But I do think there are some people who probably should have come in or who definitely need care that shouldn't be put off too much longer, who we need to find ways to bring them back into care and help them feel safe while they're doing it.
A really delicate balance for all of us. All right, Dr. Wright, thank you so much for your time. We really appreciate it. Stay well.